I am technically a third-year dental student. I've taken a year away. I'm doing my master's in global health policy at London School of Economics. So I was on a 6-hour layover in Reykjavik last night. So pardon me if I am a bit tired, but I am so happy to be here and to meet all of you formally. This is my second year doing this. I came with Mrs. Hennes last year and was able to welcome her here. And just to give you guys a little bit more of an insight to the patient prognosis and what it looks like to be diagnosed with cancer and stage 3 oral cancer as well. My first year of school, we had the same oral health day, and we were just getting to the beginning of the oral manifestations of disease. And when we were in the hospitals on Wednesdays, I was at Mass Gen, and we would go on rotations and we'd see patients. And there were so many times I would see a patient who had been intubated, and they were intubated for weeks on end, and there was no attention paid to their mouth, and no one was brushing their teeth, no one was maintaining the health of the oral microbiome. And so it just really struck me that we were trying to treat a chronic illness, treat a chronic disease, yet there was this paradox of exactly where there was this chronicity of illness and acute inflammation. Like, there was nothing done to mitigate that. I'm studying right now for my oral surgery exam, so it's basically the equivalent of step 1, and so many of the questions and cases that we get as well in those question stems have to do with oral manifestations of disease as well, whether it's tooth avulsion, whether it's swelling of a gland, a parotid gland, an ED visit. It's come up a lot, even just culturing of different bacteria and things. A very striking statistic that has come up a few times in the questions as well is when you're culturing something like endocarditis, so you have like a vegetation on the heart valve, so often it is a bacteria that originates in the oral cavity. So just recognizing these systemic connections, we've talked about them a lot this week, but it was something that really struck me my first year. And we did have a panel our first year, and I approached our faculty and asked if we could bring someone on. And I think the biggest message for me is when we silo these professions and when we're not considering the ways that they work together, it has the potential to alter the life course of so many individuals. And I happen to know one of them. She's from Tennessee as well, so representing Tennessee very strongly here today. But Ms. Hennes was my middle school teacher and soccer coach, so I've known her since 2011. And I'm gonna pull up this photo of me in 2011. This was, I think, halfway through the game, but this was our first year doing it in 2024, and just kind of the years that we've spanned and knowing each other, and kind of how full circle this is that we get to be up here and to kind of give her testimony today. And yeah, I think she's a very incredible story of her diagnosis, but one last thing I want to point out is we talk a lot about the use of tobacco and the use of alcohol and all of these factors that can determine different cancers and things in the presentations that you've seen. But Ms. Hennes she was a D1 soccer player at Davidson. She is a soccer coach, she's a personal trainer, and she has all of these lifestyle choices and healthy things that she does to promote lifestyle, and yet because of lack of prevention and lack of screening, there was so much that could have been done to keep this from happening, keep her from receiving this diagnosis a little too late. And luckily we're here to have her and to have her share her story, but it's really important. And without further ado, I would like to introduce Mrs. Natalie Hennes. Give her a warm welcome.
Can everyone hear me?
Yes.
Hi. Well, first of all, thank you all so much for having me back again this year. It means a lot, and I've told this story many, many times throughout the last 7 years, but it doesn't ever get easier. And this year, actually, my husband is here on a camera recording, and then my 2 daughters, Maggie and Samantha, have decided to join this year. So that might make it a little even more difficult to talk about it. But as an English teacher, I usually like to open with some sort of anecdote or allusion or hook, but I know you guys have breakout rooms, and I really just want to get to my story quickly and give you, last year there were a lot of questions and answers, question and answer session that we didn't really get to, and so I want to have some time for that at the end if you guys have any specific questions for me. So I'm going to avoid hooking you. I don't think it needs a hook. But I will say that, just to quickly start, a couple of years ago, we were reading a National Geographic article in my classroom, and one of the things it was talking about is what a human is. And it said, a human is three things. One, a human is somebody who has a spoken verbal language. A human is someone who walks on 2 feet, and a human is someone who can make tools with their hands. And 7 years ago, when I was diagnosed with squamous cell carcinoma in the floor of my mouth, which Dr. Swan had a photo of, all three of those things were taken away from me. And from one spot, just in my mouth, I could not move, I could not walk, my entire right side of my body was paralyzed for a long time. I couldn't speak on my own, I couldn't breathe, they had a trach for a long time, and I couldn't eat all of the things that Dr. Silk was talking about with the mouth and how it affects the entire body. And I don't just see a dentist, I see many different medical doctors now for different parts of my body that have been affected from the cancer just in my mouth.
So we kind of made an introduction to you. I want to go back and just introduce our family. But would you start by telling us a little bit more about your life before the cancer and how you kind of came to this diagnosis? What made you seek help in the first place?
Yeah, sure. As Lily said, I am an English teacher. When I wasn't teaching, I have a personal training license. I played Division I soccer in college. A mom, full-time mom as well. But it was the summer of 2017, and we were visiting my parents in Maryland, and I was eating some fresh tomatoes from their garden, and I noticed this spot under my tongue on the floor of my mouth, but it was kind of under my tongue a little bit on the right-hand side that was bothering me, and I thought it was simply just a canker sore. And about a week and a half, 2 weeks later, we were back in Nashville, and it was still there, and that's when I called Dr. Gordon, her mother, who was my dentist, and she took a look and talked to me and was like, if it's not gone in another week, call me. And so I called her again a week later, and she said, let's get you in to see an oral surgeon quickly and have it biopsied. And that's when I went to see Dr. Coyne, who looked at it, didn't think it was going to be anything, small private practice, but she biopsied it nonetheless, and then 10 days later, my husband and I went in for the results, and it was squamous cell carcinoma, floor of mouth malignant, and she said, we need to move, and we need to move fast. And she recommended a few different places, off the top of my mind, MD Anderson, but Vanderbilt has a really great program as well, and so I decided to stay local since I had 2 children who were 4 and 7.
And will you give us a little bit more information too on how quickly the symptoms arose and how long it took you to kind of get to this point of care where you were waiting in the hospital for surgery?
Yes, and I do want to say that I was very lucky that we knew some people at Vanderbilt. My husband knew some people. My brother, who works in healthcare, my father is a gastroenterologist. We knew some people, and I was able to get in quickly to the point that I went through all of the CT scans, the PET scans, everything, and I was diagnosed on October 4th of 2017, and on October 23rd of 2017, I was in for my surgery to have that spot removed, and I happened in the surgery?
Yeah, I guess a good transition. What exactly did they perform? How were you feeling? What was the response of your family? How did you let your family know, and your girls, especially at that age?
Okay, when I was diagnosed, Rob and I were in shock, as anybody would be, and immediately called my parents, and my dad, who my entire life growing up playing competitive soccer and everything, my whole life growing up, it was always, if I felt sick, you're fine, you're fine. He had seen so many different things in the medical profession, you're fine. But I remember when we called him, we FaceTimed him, and he started to cry, and he doesn't cry. I knew that it was more serious than I understood, or was willing to understand. But so we told them immediately, and I grew up in Maryland, they came immediately to Tennessee to help. And as far as telling the girls, that was probably the hardest part. I knew we needed to tell them because I was going to be gone for a while, just unavailable, gone. And so I called their pediatrician, and I asked him, how do you tell a 4 and a 7-year-old that their mom has cancer and might not survive? And he said, be simple, be honest, and be hopeful. And so I spoke with both my girls separately, because I knew Samantha at 7 would understand things a little bit differently than Maggie at 4, and had a conversation with them, and both of them handled it very well early on before they kind of made the connection of what would happen. And then they went to my sisters in Tampa for a while during the surgery, so my husband and my parents could help. And I'd like to talk about that a little bit, because as an oral cancer patient in the hospital, I want to talk about having an advocate and why you need one.
Will you walk us through the surgery itself, and what exactly did the doctors find? And yeah, how are you feeling after? Just explain exactly what they did in the OR.
Okay, in the surgery, they, to remove the cancer, they removed about 20% of my tongue on the right-hand side, the entire floor of my mouth, part of my lower right gums, 4 teeth, which I know now are numbered. Whoever said that. 4 of my teeth on the bottom right-hand side, and then to rebuild, they did a radical neck dissection on my right side to remove 35 plus lymph nodes. Salivary gland, one of my salivary glands was removed. You all probably know the official name of which one it was, but one of them was removed. And then to rebuild, so the first half of the surgery took about 4.5 hours, and then the second half took 4.5 to remove the cancer, and then 4.5 to rebuild. And they did, they used my left arm, forearm, or my left forearm. They used my forearm tissue, and then an artery as well, because they needed blood flow. And so between all of that, the swelling, I had a trach to help me breathe, a feeding tube, a nasal feeding tube, a cast on my left arm, and then I couldn't move the entire right side of my body because of the radical neck dissection.
And I want to really emphasize too the prognostic rates for the different staging. Like, we keep emphasizing the importance of the screening and the early detection, but if you're looking at the prognostic rates of stage 1, stage 2 cancer, you're looking at something like 86%. They're very, very high. You can do a simple excision and biopsy and kind of be done with it. But when you have a late diagnosis and it has metastasized and gone through the cervical chain, and it's required 40 lymph nodes to be removed, you're having systemic complications. Luckily, you didn't have to have radiation done, but often that is the case. And so when I think Dr. Silk gave the statistics of like 50% of these, the mortality is 50% in a 5-year period because of the screening. And I cannot emphasize enough why we're talking about this. It did not have to evolve into what it did. And I want to give just a couple of photos of Natalie after her surgery as well, and just kind of emphasize how debilitating it really is. And yeah, do you have anything you want to share about right after the surgery?
This was very much all. I have moments of memory of some of these things. I do especially have a moment of that middle one, which is where he had to remove the trach temporarily to remove like a blood mucus that had gotten kind of stuck, which my husband finds to be actually a humorous story amongst the madness, because I was telling my nurse that I couldn't breathe, and finally they called the on-call doctor. It was late at night, and he came in, and he said, all right, we're gonna remove this, and when I do, you're gonna cough through your throat. And he said, on the count of 3, I want you to cough. And he said, 1, 2, 3, and I coughed, and out shot this like bloody mucus, and it hit the wall. And Rob was in the room, and he goes, God, I wish I had that on camera. And so it was a moment of humor amongst scary as well, but there's other moments we remember. And then over there on the right is just my dad, who I think wore his scrubs in the hospital and was my advocate and nurse and everything for the, I don't know how many, 2 weeks that I was in the ICU and critical care unit.
Tell me more about the advocacy and why you find it important. I think a lot of patients who come in are scared and they aren't well versed on the medical terminology, and yeah, I do think it's important, but from your perspective, how did you think about this?
With me, my personality is I wanted to know exactly what could happen. I wanted to know exactly the bad, the worst, everything that could happen, so I could mentally prepare myself for it. I know some people prefer to not know. They just want to go in with that positive mindset. I wanted to go in knowing the worst, hoping for the best. And one of the, I spoke with somebody in my local community who went through something very similar to me, and I met them through Gilda's Club. I don't know if you have a local chapter of Gilda's Club, but it's one of the most amazing free places that people can go just to have a group of people who have suffered from the same type of cancer, and they cover every single cancer. And so we have a head and neck cancer group in Nashville, and so I met a lady through that, and she and I spoke, and she doesn't speak as well as I do. She had more of her tongue removed, but she told me, you want to have somebody in the hospital with you at all times, because you can't speak, you can't talk for yourself. And so in some of the most scary moments where you feel like you can't breathe, or you feel like you're nauseated and are about to vomit, but you have a feeding tube and your doctor said you can't vomit, you've got the feeding tube, you need someone to speak for you. And I remember my mom or my dad or Rob was in the bathroom, and there was a scary moment, and I clicked for the nurse, and they got on the loudspeaker saying, how can we help you? And in most cases, people can say, please come immediately, but in my case, I couldn't say that. And so I just, it was so important to have somebody there for the speaking impairment alone that goes along with it.
I do want to touch, because I don't think you mentioned it, the board that you wrote on, or like the different ways that you were able to communicate and find unique sources, but then as well, if you'll kind of go into the complications that persisted even after the surgery was done. I think we often think of surgery as kind of being a one-off, you go into recovery, but what happened beyond just the...
After I got home, it was about 9-10 days later, I just noticed down on my neck, you can see the little white abscess, kind of white inflammation spot, and my dad thought it was something that we needed to have checked out, so we went to the ER at Vanderbilt, and I think I mentioned this last year. This was the night that Vanderbilt was moving over to their new platform called Epic, emergency room. And they had my records because I had been there, and they were able to get me back into the hallway temporarily where they were treating me. But they found out that it was Campylobacter, an infection, and then they had to drain that. So that was one of the things. That was the first, I guess, complication that I had right after. And then I had to continue draining that at home after the initial drain.
Yeah, what did your home care look like? Who was taking care of you? What was bed rest?
Pretty much in my bed the entire time. Like I said, my whole, and from the surgery itself, just not being able to eat anything other than ensure whatever it was that you all were giving me through that feeding tube. You just, it's truly the expression you were hit by a truck. I couldn't move. I also couldn't wash myself because my right side, I couldn't move my arm from the neck dissection, and so I had to have people bathing me, sponge bathing me, helping feeding tube, a lot of medication that had to be crushed and put through that feeding tube as well. That was really, my dad kind of did most of that every morning and every night. And then when the girls came home, that was more of the emotional, mental side of it. They had to be reintroduced to their mom, who didn't quite look like mom.
This is just an image of the.
Took off the bandage the first time.
Yeah. What was your initial reaction to the limitations in mobility that you experienced as well? She is a very avid tennis player, has a very social, full life. So obviously there was limitations that you experienced.
I was very naive when my otolaryngologist told me she was going to take tissue out of my arm, and I just remember looking at her before the big surgery, and I said, "Can you just make sure it's my left arm so I can play tennis?" And she laughed, and she made sure it was my left arm, but it's fine. I do wear a protective. I wear this every day. It doesn't bother me that I have a scar. It's more just protection, just because as you can see. And my students ask me about it, and I tell them at first it's just a shark bite. But
You want to tell them more about the healing of your neck and also your tongue as well?
Sure. I've had to have 2 surgeries in my mouth since the original, just for debulking purposes. They put in more tissue than was necessary early on, not knowing. You just kind of do what you think you need to do. And I remember her telling me we wanted to put more in rather than less. We'd rather have to take it out later on than add it back in. And so I had to have 2 debulking surgeries, and I have had, you know.
You can mention it.
It was 3 years after the surgery. I was at school teaching, and my blood pressure had been kind of going up for a few weeks, but really it spiked, and I almost passed out in a meeting, and they called the nurse in, and she got my blood pressure, and it was dangerously high, and so they got me to the emergency room, and we found out through, the Autonomic Dysfunction Center at Vanderbilt that I have something called baroreceptor impairment, which is a secondary heart problem that is from the radical neck dissection, and it has I'm not an MD, I'm an English teacher, but it has something to do with the way your carotid artery speaks to your heart, and so I have to treat my heart as if I have high blood pressure, high heart rate, and take 3 medications every day for that, even though it's not an actual heart or primary heart problem.
We kind of skipped over some of these slides. No worries. But just tell us more about the different scope and the different types of clinical care workers that you saw, and who you found was critical to learning how to speak again, and all the daily functions of your life.
So, dentist, oral surgeon, prosthodontist, who was able to give me 3 of my 4 teeth back through a bridge for so many wonderful reasons, which I didn't even know about. And I was able to do that because I didn't have radiation. And then also otolaryngologist, two of them who ultimately saved my life. Cardiologist for my heart, speech therapist to help me speak again, physical therapist to help me move my body again. I mean, I don't know how many I just listed, 8 to 9 different. And there's probably more that I'm forgetting. Implant surgery, ER doctors who helped with the Campylobacter. So,
something that I want to emphasize too, and she touched on it, but obviously with chemotherapy, there's a weakening of the bone that occurs too, and most patients who have this later diagnosis with stage 3 and 4, often they'll come in and they can't have any sort of implants placed just due to weakness of the bone as well. So they have the option to get a full denture, but if the bone is resorbed too much due to extensive radiation, which is often the case, then many of these patients can't receive any form of aesthetic function as well. And if you just think about the mouth and how obviously it serves its function in eating and being able to, not work through a feeding tube, but also it's just your psychosocial, right? Psychosocial element of being able to exist in life and work and function and speak with people you love, that often gets stripped away from these patients as well. And it's not something you can hide. I think with COVID, we've seen a lot of cases where people can wear masks, and there are ways to cover these things, but emphasizing, yes, dentistry can be a very cosmetic thing, and it often is when we see people with orthodontics and braces and Invisalign and things, but so often is the case that it is a matter of function and form, and just a lot, giving people kind of the grace to, exist in their social lives and kind of integrate back into the normalcy of it all. So this is just an example of, again, the scope of care that she received throughout her time working with different clinical care workers as well. You want to talk about the pain of the sores?
Well, also an oral surgeon and an oncologist. So I forgot too of 10 plus types of doctors, all who have helped in the process. And I continue to see, I think, pretty much all of them except for the speech therapist. But I continue to get sores in my mouth. Mainly, I have actually a sore on the spot of where the cancer is diagnosed, which has been of concern to me. However, my doctors they don't think it's anything. They think it's from the tongue, which is really my tissue, and rubbing up against the new prosthetics. And so there's that sore that just pretty much doesn't go away. But then I have a tendency to get sores around my salivary glands because they're working really hard because I'm missing a salivary gland. And so if I don't stay hydrated enough, they have a tendency to become blocked and then become sores.
One more thing, because I do want to open it up for questions and make sure that we give time for the girls to speak as well about their experience with this, but just in terms of the radiation and cancer as well, worked with a couple of oncologists who often say one of the primary reasons that patients will choose to stop chemotherapy and radiation is due to the pain that it causes. Like, the number of neurons that you have in your mouth and in the oral cavity are extensive, and the pain that occurs often leads patients to quit early. So just having that consideration as well when you have the patients who come in. It's a very sensitive area for many reasons, but I'm so forever lucky that you didn't have to go through that process of radiation as well. But yeah, I guess we can open it up to questions, but if you want to just end on the support system that you had and kind of tell us a bit more about who you relied on.
Everyone I feel like I relied on. I've never really seen a community come together like mine, And I was always very close with my parents and my sister and my brother, but just the way my parents immediately came in and lived with us for months and helped, and my sister took the girls to Tampa to live with them for a little bit during the worst parts of it all. My brother in healthcare, just helping get things, helping just be an advocate in that industry. My husband being my just best friend and advocate in everything in that moment. Samantha, who might not even remember this, she would get off the bus and come and sing Pete's Dragon song, Candle on the Water to me every day after school, and then the community with meals and everything, and then the doctors, all of the doctors, some of whom are some of my closest friends now. So yeah, it's just, I just hope I'm a face where I hope you remember, like, when you have your patients, it's not just, patient A, and you remember that there's so many more people involved, and I hope I can be that a little bit for you today. And I don't have a Da Vinci photo, and I don't have an Amanda Gorman quote. However, my students yesterday, because they're still in school today, they made me some little words of encouragement, and I read them on the plane last night. So I'm gonna leave you with one quote from one of my 13-year-old students named Jack, because I told them if any of them could make me laugh, or that they would get candy when I got back. So he said, and this was for me, but I actually think it's a great one for all of you. And I never heard it before. I don't know if he made it up or what, but he said, "Be like a scarecrow and be outstanding in your field."
And we'll leave it with that.